I'm Kat Fay. I'm a managing partner at Perpetual's community and social investments business, and we work with philanthropists and non-profit organisations. What brought me to philanthropy is what brings a lot of people to philanthropy, which is it's an opportunity to actualise your values. And sometimes you do that in how you volunteer. Sometimes you do that actualisation through the decision to give money away. But in many instances, philanthropy is actualised through the decisions you make on where you want your donation, whether it's your donation of time or treasure, to actually go. At Perpetual, we're an advice organisation. We provide advice to families and individuals on their philanthropy. We believe that a gender lens and an application of a gender lens leads to much better outcomes for communities and in grant making. So we decided, as part of our review of applications that were coming in, we needed to ask organisations whether or not in their program design they were actually applying a gender lens. And doing that has enabled us to have greater confidence in putting projects in front of the families and individuals that we're working with, and a lot more surety that those projects that are applying a gender lens are going to have the type of impact that we're hoping to see in community. I think one of the really interesting applications of a gender lens is in the medical research space. And quite often, medical researchers historically have only utilised, for example, male mice. And ultimately have created solutions in the medical and health fields that, through that practice of research, tend to benefit men more than they benefit women. So applying a gender lens around medical research not only leads to better outcomes in terms of research dollars going to female researchers, for example, but it leads to better health outcomes in research that's ultimately aimed at support for the broader community. For example, I've worked with clients who have been really dedicated to investment in women and girls, who have ultimately over 3 or 4 decades been investing in the investigation into the creation of an HPV vaccine. Now that has been achieved in terms of creation of a vaccine, and now those philanthropists are moving their action on to how do we ensure that all women and girls have access to that particular vaccine. Now we know when women become sick, the impact on their families and the ultimate impact on their communities ends up being quite significant. So in ensuring that we can find those types of solutions that benefit women and girls in those instances, the knock-on effect for community, whether that's men, women, children, ultimately ends up being incredibly significant. Some of the most inspiring philanthropists that I've seen across my career are the individuals who just refuse to allow situations to be the way they are. An individual like Georgia Matthews, who in her mid-20s decided that funding to LGBTQ plus communities was incredibly low and life outcomes were incredibly poor within those communities. And she said enough is enough, and ultimately set up a giving circle that has led to a significant increase in philanthropy moving into those communities. That's real impact. And then at the other end of the scale, you have an individual like Vera Ramashotti, who was suffering really tragically from diabetes, decided to sell some buildings, ultimately to set up a fund that would lead to investment in outlier biomedical research for the benefit of all humankind. And her investments have led to advances in the cochlear implant, the creation of the HPV vaccine, and really incredible things. So I'm often inspired by women who just ultimately want to enact and be the change they want to see in the communities they care about. Over the coming decades, we're going to see digital technologies and AI really impact our communities, both in positive ways and potentially in negative ways. I think the core thing for philanthropists to remember as we move forward into this new world is ultimately to keep centering humans, to keep centering people in their decision making. Data's fantastic, but ultimately we need to listen to the voices of the communities that we're attempting to serve as we design outcomes that are ultimately meant to lead to better social outcomes for everyone. When I'm talking to folks that are new to philanthropy, I always say keep it simple. Do the simple things well in philanthropy. Find organisations that you trust, listen to them about what they need to spend money on to have an impact, and if possible, give to them over multiple years. All of those really small things ultimately will lead to a fantastic impact in philanthropy.